I want you to think about your breakfast this morning. What did you eat? Maybe it was something you have eaten every single morning for years, something you thought was perfectly fine, something that even felt healthy. But what if I told you that one food, one that most people over 60 eat before 9 in the morning, is silently driving your blood sugar to dangerous levels? And the terrifying part, it does not feel like anything at all. No pain, no obvious sign, just quiet damage building up inside your body every single day. This is not a small problem. Over 37 million Americans have diabetes right now, and more than 96 million have prediabetes, and 8 out of 10 of them have absolutely no idea. Many of those people are over 60. Many of them are eating this food right now. Stay until the end of this video because I am going to name the exact food, explain exactly what it does to your body after 60, and give you a simple plan to protect yourself starting tomorrow morning. Welcome back to Senior Health Secrets Over 60. I am Dr. Jessica Reed. If you are new here, welcome. I am so glad you found this channel. Every week I bring you honest, clear health information that your doctor may not have time to explain. Please take a moment right now and hit that subscribe button and tap the bell so you never miss a video. This information could change everything for you. Today we are talking about blood sugar, and more specifically, we are talking about what is happening to your blood sugar before you even finish your first cup of coffee. Let me ask you something honest. Have you noticed that your energy crashes hard around 10 or 11 in the morning? Or that you feel foggy after breakfast? Maybe you are hungrier sooner than you expect, or you feel a little shaky before lunch. A lot of my patients describe this and just assume it is part of getting older. They say, "Well, Dr. Reed, I am just getting old. That is why I am tired." And I have to gently tell them, no, that is not aging. That is your blood sugar sending you a distress signal. According to the CDC, adults over 60 are at significantly higher risk for blood sugar problems than any other age group. Your pancreas produces less insulin as you age. Your cells become less sensitive to that insulin, and your ability to recover from blood sugar spikes gets slower every decade. So what might have been harmless at 40 is genuinely dangerous at 65. And here is what breaks my heart as a doctor. Most of my patients are doing everything they think is right. They are trying to eat well, they are reading labels, but nobody warned them that one very common breakfast food is making all of this so much worse. That ends today. I have been practicing medicine for over 15 years. I have worked with thousands of patients over 60, helping them manage blood sugar, diabetes, heart health, and more. And again I see the same pattern. Smart, careful people doing real damage to themselves without knowing it, because nobody told them the truth. Well, I am going to tell you right now, because that is exactly what this channel is here for. So let us get into it. I am going to walk you through 7 things that are happening inside your body. 7 reasons this breakfast food is so harmful after 60. And I want you to hear every single one of them, because each one is more important than the last. The food I am talking about, the one food causing all of this, is packaged breakfast cereal. Specifically, the processed grain-based cereals that have been a staple on American breakfast tables for decades. And yes, that includes the ones that say whole grain on the box. That includes the ones with the heart healthy stamp. Even the ones your doctor may have recommended years ago. Let me explain exactly why. Breakfast cereal spikes your blood sugar faster than almost any other food. Think about that for a moment. Most processed cereals have a glycemic index. That is the measure of how fast a food raises your blood sugar, higher than white bread, higher than white rice. Some of them are nearly as fast as pure table sugar. When you pour that bowl in the morning, your blood sugar shoots up like a rocket within 20 to 30 minutes. Now, when you were younger, your body could handle that. It would pump out enough insulin fast enough to catch that spike and bring it back down. But after 60, that system is slower. Your blood sugar stays elevated longer. And that prolonged elevation is exactly where the damage begins. I had a patient, a lovely 68-year-old woman named Margaret, who came to me feeling exhausted every morning by 10 a.m. She was eating a bowl of so-called heart-healthy oat cereal every single day. When we checked her blood sugar 2 hours after breakfast, it was alarmingly high. She had no idea. We simply changed her breakfast. Within 3 weeks, her energy had completely transformed. After that spike comes a crash, and that crash is doing serious damage. Here is what happens inside your body. Your pancreas panics when it sees that blood sugar spike. It floods your system with insulin to try to bring the sugar down. But after 60, the system overshoots. Your blood sugar does not just return to normal, it swings down too far. That is when you feel the shakiness, the brain fog, the sudden hunger, the irritability. And here is the dangerous part. Your body reads that low blood sugar as an emergency. It releases stress hormones, cortisol, adrenaline. Those stress hormones raise your blood pressure. They put strain on your heart, and they make your cells even more resistant to insulin over time. So every bowl of cereal is literally training your body to handle blood sugar worse. One of my male patients, Robert, 72 years old, was having what he thought were anxiety attacks every morning around 10 a.m. Heart racing, sweaty, shaky hands. It was not anxiety. It was reactive hypoglycemia from his breakfast cereal. His cardiologist had no idea. We solved it by changing his first meal of the day. Breakfast cereal is destroying your insulin sensitivity, and most doctors are not connecting the dots. Insulin resistance is the root cause of type 2 diabetes. It means your cells have stopped listening to insulin's signal. And every single time you cause a blood sugar spike followed by a crash, you push your cells a little further into resistance. It is like ringing a doorbell over and over. Eventually, the person inside stops answering. After 60, your cells are already naturally less sensitive to insulin. That is just biology. But eating cereal every morning is like throwing gasoline on that fire. According to research from the American Diabetes Association, repeated blood sugar spikes are one of the leading drivers of progression from prediabetes to full type 2 diabetes. And the tragedy is, millions of seniors have no idea this is happening until it is far along. Do not wait for that. The hidden sugars in breakfast cereal are far beyond what the label admits. You look at the box. Maybe it says 8 grams of sugar per serving. Sounds fine. But here is what the label does not tell you. When your body digests the refined flour and processed grains in cereal, it converts them directly into glucose, sugar. So even a cereal that looks low in sugar on the label can behave like you ate 4 to 6 teaspoons of pure sugar in your body. And most people do not eat one serving. They fill the bowl. I had a patient, Eleanor, 66 years old, who showed me her cereal box proudly. Only 6 grams of sugar, she said. When we tracked what that breakfast actually did to her blood glucose, it was the equivalent of drinking a can of soda. She was absolutely stunned. The food industry knows exactly how to use labels to mislead you, and after 60, your body simply cannot afford that. We are at the halfway point of this video, and I have 4 more critical points coming. But before I continue, if this information is helping you right now, please take just 2 seconds and hit that like button. It helps me reach more seniors who desperately need to hear this. And if you have a parent or a friend over 60, please share this video with them right now. It could genuinely protect their health. Okay, back to it. Because what is coming next is about your brain, and it surprised even me. High blood sugar from your breakfast is quietly damaging your brain, and the connection runs deeper than most people realize. Your brain runs on glucose, yes, but it needs a steady supply, not spikes, not crashes. Steady. When blood sugar swings wildly every morning, your brain is getting flooded and starved in cycles. Research published in the New England Journal of Medicine found a clear link between elevated blood sugar and increased risk of dementia, even in people who are not diabetic. They even gave it a name, type 3 diabetes, because the connection between insulin resistance and Alzheimer's is that strong. After 60, your brain is already more vulnerable to inflammation. Feeding it a blood sugar roller coaster every single morning is accelerating that damage. I had a patient, a 70-year-old retired teacher named Dorothy, who was terrified about her memory. She was forgetting words mid-sentence, losing her train of thought, one of the first things we changed was her breakfast. 3 months later, she told me the fog was lifting. Brain health and blood sugar are inseparable after 60. Please do not ignore this connection. Breakfast cereal is sabotaging your heart health in ways your cardiologist may have missed. When blood sugar spikes repeatedly, your body releases inflammatory compounds into your bloodstream. Over time, those compounds damage the walls of your blood vessels. They make your arteries stiffer. They raise your triglycerides. They raise your LDL, the bad cholesterol. The American Heart Association reports that people with poorly controlled blood sugar have 2 to 4 times the risk of heart disease. And here is the cruel irony. Many cereals advertise themselves as heart healthy. The heart healthy stamp does not protect you from blood sugar damage. It simply means the fat content is low. But fat is not what is damaging your heart here. Sugar is. My patient James, 74 years old, had 2 stents placed in his arteries. His cardiologist told him to cut fat from his diet. He switched from eggs to cereal every morning. His triglycerides climbed. His blood sugar climbed. When he came to me, we reversed that immediately. After 60, your gut processes cereal completely differently than it did when you were younger, and nobody is talking about this. As we age, our gut bacteria change. The beneficial bacteria that help regulate blood sugar become less abundant. Processed grain products like cereal actually feed the harmful bacteria and starve the beneficial ones. This creates a cycle of inflammation that makes insulin resistance worse. It slows digestion so blood sugar fluctuates even more unpredictably. And it increases intestinal permeability, sometimes called leaky gut, which floods your bloodstream with inflammatory signals. All of this from the bowl you poured before the sun came up. After 60, your gut is more vulnerable to this damage than it has ever been. And repairing your gut health starts with removing the foods that are breaking it down. Here is exactly what you need to do starting tomorrow morning. And I want you to know, this is not about being perfect. This is about making one important shift that your body will thank you for every single day. First, remove the cereal from your morning routine. You do not have to throw it away today if that feels overwhelming. But make the decision right now that this is the last week you start your morning that way. Second, replace it with a blood sugar stable breakfast. Eggs are one of the best options available to you. 2 or 3 eggs in any form, scrambled, poached, boiled, give you protein and healthy fat that holds your blood sugar steady for hours. Avocado is another powerful option. Greek yogurt with no added sugar is excellent. A small handful of nuts with a hard-boiled egg is quick and powerful. Third, add fiber to every breakfast. Fiber slows the absorption of any carbohydrates you do eat. Even a tablespoon of chia seeds stirred into your yogurt can make a significant difference in how your body handles that meal. Fourth, do not eat breakfast within the first 30 minutes of waking. Give your body time to naturally regulate its morning cortisol before you introduce food. Just 30 minutes of waiting can reduce your blood sugar response to breakfast significantly. Fifth, drink a full glass of water before your first bite of food every morning. Hydration improves insulin sensitivity. It is one of the simplest things you can do, and most people are skipping it. Sixth, after breakfast, take a gentle 10-minute walk. Even a slow walk around the block or around your home after eating causes your muscles to absorb glucose directly, bypassing insulin entirely. That one habit alone can lower your post-meal blood sugar by 20 to 30 points. Studies back this up. It is one of the most powerful tools you have. I want to take a moment before we close today to make sure you heard everything that matters. We talked about how packaged breakfast cereal spikes your blood sugar faster than almost any other food, and why that matters even more after 60. We talked about the dangerous crash that follows, and how it puts strain on your heart and trains your body toward insulin resistance. We talked about hidden sugars the label does not show you. We talked about the connection between blood sugar and brain health, and why protecting your memory starts at the breakfast table. We talked about what cereal does to your heart and your gut, and how those systems are more vulnerable after 60 than at any other point in your life. And we talked about exactly what to do instead. Simple, realistic, powerful changes you can make starting tomorrow. You deserve this information. You deserve to feel well. You deserve energy in the morning, clear thinking, a strong heart, and none of that is out of reach for you. I see it with my patients every single week. Simple changes, consistent effort, real results. I want to hear from you in the comments right now. Tell me, what have you been eating for breakfast? Are you going to make a change after watching this video? I read your comments and I respond, because your health matters to me personally. If this video helped you, please hit the like button right now and share it with someone you care about. And if you have not subscribed yet, please do, because next week I am covering something that affects almost every senior over 65. And most people have no idea it is happening inside their body right now. You will not want to miss it. I am Dr. Jessica Reed, and I will see you next video.